Test item cluster for mechanical neck pain that benefit from thoracic manipulation includes patient having symptoms less than 30 days, patient has no symptoms distal to shoulder, looking up doesn't aggravate the patient's symptoms, patient scores less than 12 on the FABQ physical activity subset, and the patient has diminished upper T-spine kyphosis, and the patient has less than 30 degrees of cervical extension. Go ahead and look up for me. The test item cluster for full thickness rotator cuff tear includes a positive drop arm sign, a positive painful arc, and a positive infraspinatus muscle test. The drop arm sign. To perform this test, the therapist passively abducts the patient's shoulder to 90 degrees. Next, the examiner asks the patient to slowly lower their arm back to their side. The test is positive if the patient is unable to do so or experiences severe pain while performing the movement. Let your arms slowly back to your side. Painful arc test. For this test, the therapist has the patient perform active abduction through their full range. And you just bring your arm out to your side as far as you can and let me know if you have any pain.
It kind of starts to hurt right about here.
Okay. Infraspinatus muscle test. For this test, the patient stands with their arm at their side and their elbow flexed to 90 degrees. The patient then internally rotates their shoulder 45 degrees, and the therapist applies a medial force to the dorsal forearm while instructing the patient to resist. A positive test occurs if the patient is unable to resist or experiences pain during the test. Hold your arm in this position here. Let me know if you have any pain with this. I'm going to push right here. Don't let me push you towards your stomach.
It kind of starts to hurt.
Okay. The test item cluster for subacromial impingement includes a positive Hawkins-Kennedy impingement sign, a positive painful arc sign, and a positive infraspinatus muscle test. A Hawkins-Kennedy impingement sign. For this test, the patient is standing or sitting. The therapist flexes the patient's shoulder to 90 degrees, flexes the elbow to 90 degrees, and once in this position, the therapist applies an internal rotation force to the forearm. Positive test occurs if the test is painful for the patient. Bring your arm up like this. Rub it in. I'm going to push down right here. You let me know if you have any pain with this.
That hurts.
The test item cluster for mechanical neck pain that benefit from cervical manipulation includes patient has symptoms less than 38 days, patient has an expectation that manipulation will help, patient has pain with PA testing of mid-cervical spine, and patient has a difference of at least 10 degrees in cervical rotation from one side to the other. Go ahead and look to your left. PA testing of the C-spine can be done with the patient in prone. Using the tips of both thumbs, a gentle PA force is directed through the spinous process of C2 through C7. The test item cluster for cervical radiculopathy includes a positive upper limb tension test A, with the median nerve bias, a positive Sperling's test, a positive distraction test, and less than 60 degrees of ipsilateral cervical rotation. Upper limb tension test A. To perform this test, the therapist passively depresses the scapula and sequentially supinates the forearm, laterally rotates the shoulder, extends the wrists and fingers, and extends the elbow slowly. Sperling's test. Passively brings the patient into cervical side bending toward the symptomatic side. Then applies overpressure. Next, the therapist applies ipsilateral cervical rotation and extension and applies overpressure. A positive test occurs when the patient experiences reproduction of their peripheral symptoms. Distraction. The therapist places one hand on the forehead and one hand under the occiput and pulls towards their stomach. A positive sign is indicated by the patient experiencing a reduction of symptoms. The upper limb tension test A. The therapist passively depresses the patient's scapula with the shoulder in 90 degrees of abduction and holds this position as the other hand sequentially supinates the forearm, externally rotates the shoulder, extends the fingers and wrist, and extends the elbow. The therapist notes the degree of the elbow extension where the symptoms occur. The two sides are compared to each other, and a positive test result is found when there is a difference of greater than 10 degrees. Differential diagnosis of a rotator cuff tear or shoulder impingement versus either a C5 or C6 radiculopathy. To test for a full thickness rotator cuff tear, the clinician will perform a drop arm test, a painful arc test, and an infraspinatus muscle test. A positive drop arm test will detect the pathological weakness that is indicative of a full thickness rotator cuff injury. I'll demonstrate the drop arm test. Slowly let your arm down to your side. Positive test. If a rotator cuff tear is only partial thickness, the drop arm test will still be positive. However, the patient will be able to catch the arm at some point in the range instead of letting it completely fall. To test for shoulder impingement, the clinician will perform a Hawkins-Kennedy impingement test, a painful arc test, and an infraspinatus muscle test. A positive Hawkins-Kennedy test provides the strongest evidence to indicate AC joint pathology and subacromial impingement. I'll perform the Hawkins-Kennedy test. Let me know when and where you have pain with this movement.
Right there, and it hurts. Right there.
A C5 or C6 radiculopathy will present with impaired sensation in the C5 or C6 dermatomal distribution, which is the lateral arm to forearm for C5, and lateral forearm to thumb and index finger for C6. They'll also present with diminished reflexes in the C5 or C6 nerve roots, which will be the biceps reflex for C5 and C6, and the extensor carpi radialis for C6. They'll also present with weakness in the C5 or C6 myotomal patterns, which will be shoulder abduction for C5 and elbow flexion and wrist extension for C6. The active compression test of O'Brien. For this test, the patient is standing with the shoulder flexed to 90 degrees and the elbow fully extended. Next, the patient horizontally adducts 10 to 15 degrees and internally rotates so their thumbs face down. The therapist will then apply a downward force to the arm. The test is then repeated with the arm supinated and externally rotated. If pain is on the joint line or painful clicking is produced inside the shoulder during the first phase of the test and is not present or decreased in the second phase, the test is considered positive. Phelan's test. This test is used to detect carpal tunnel syndrome. For this test, the therapist maximally flexes the patient's wrists and holds it for 1 minute by pushing the patient's wrists together. This test is considered positive if the patient experiences tingling in the thumb, index finger, middle finger, and the lateral half of the ring finger. This is caused by pressure on the median nerve. Shoulder abduction test. The therapist passively abducts the arm so that the hand rests on top of the head. The patient can also do this actively. A positive test is found when the patient experiences a decrease or relief of symptoms. The jerk test. To begin, the patient is sitting with their arm internally rotated and flexed to 90 degrees. The therapist grasps the patient's elbow and actively loads the humerus. Next, the therapist moves the patient's arm into horizontal adduction. A positive test occurs when a sudden jerk or clunk is felt during the test.